Okay, I'm Mrs. Jothilakshmi, working as an professor in the KS College of Nursing in the Department of Obstetrics and Gynecological Nursing. Let me thank the conference team and also especially Dr. Ghazal for her constant support. And here I am to discuss about some literature reviews which is supporting the assertiveness skill to manage workplace stress. I think we people are familiar with the stress. So stress is a state of mind where emotional strain is a result of person's reaction to difficult stimuli. Okay. Let me explain some of the factors which influence the person's mental, physical, and social health also. Everyone might have experienced fight or flight response. The person is not sure whether to confront or avoid a situation that results stress. Aisha, okay, then when as a workplace, lack of self-esteem, lack of communication, and lack of what to say skills to meet the task that often results stress in the workplace. So when an employee is unable to handle work demands with the skill he deserves, results stress. So that is when a person is not having an adequate skill to meet the task which is being given by the employers. In that condition, the person faces a stress. And also, the person not able to maintain adequate communication with the co-workers or else the team members. In that situation, the person may feel a stress and also lack of self-esteem. That also leads a stress. So then what is assertiveness? Assertiveness is in psychological terms, that is, refers to the ability to express one's thought, feeling, and needs in a way that is direct, honest, and respectful. So if you ask me, what is meant by assertive? If a person is so politely expressing his desire, his or her desire, and then politely expressing whenever the chance to say no, that time the person is expressing no in a polite manner. That is called assertive. So let me share my own experience. In my view, assertive is an essential skill to avoid internal conflicts, what I'm saying. So particularly those that align with the conscience. So conscience is very much important. When we people are working, we face a lot of situation. The challenges are conscience, especially in the field of health. We people have to follow some professional ethics. That time, a lot of challenges will make us to. That is a tough job, I say. That make us to work with ethics. Sometimes we not able to follow that work ethics also. So that time, what we have some internal conflicts. So some of the assertive skills that may help us to face such a situations. So in my experience, I worked as a nurse counselor and under the HIV project. So the joint director of the health service in the particular district inquired me about the details of antenatal woman infected with HIV on that time. So he was so stubborn, even though he was quite insistent. So at last I removed all the personal data before submitting. At that moment, he was threatening me that I'm going to just, I'm going to remove you from your job like that. He has threatened me. Simply, I replied him, it's my responsibility to attend my professional ethics. In that case, I have expressed my assertiveness in such a way. I have communicated that I don't want to share the personal details of the persons those who are committed under my care. So this is called assertive. So here, these are the literatures have been reviewed by me. That assertive training improves self-esteem, assertiveness and job stress, assertiveness and conflict management at workplace. So literature review regarding the assertiveness training improves self-esteem. So self-esteem and stress are closely related. People with low self-esteem lacks in social interaction, conflicts, lack of team spirit. Those with low self-esteem design task in work situation as stress. Assertive training improves self-esteem, helps to handle workplace stress. So here are some of the example studies which is constantly stating that assertive skill which improves self-esteem. So Amal Connect carried out a study to evaluate the effectiveness of assertive training to improve the self-esteem among nurses. Training focused on assertive communication, the way to express the desire in polite manner, way to express objection in an assertive way through demonstration, role play, behavior rehearsal, and feedback. And total of 60 participants were among 60. 30 were in experimental home and 30 were in control home. After the intervention, 30 of them in experimental group demonstrated significant improvement in their self-esteem levels. So what's the final conclusion? The effectiveness of the training was that statistically proven through measurable improvement in the communication skill and heightened awareness. These findings suggest that assertive training can be a valuable tool for boosting self-esteem in professional settings, particularly among nurses who often face stressful situations in their roles. This was the next study, then G.A. Abed et al., which examines the effect of assertive training on improving the self-esteem of psychiatric nurses. This is an important area of research, especially in the context of psychiatric nursing, where high emotional demands can impact both self-esteem and job performance. So in this study, the researcher, according to the researcher, being assertive helps the nurses to own stress, make them to verbalize their need boldly and to use constructively. They conducted a study with the aim of improving self-esteem through assertive training. Further, it has been proved statistically there was a positive correlation in self-esteem and assertive skill. That is, when there is an improvement in the skill, there is an improvement in the self-esteem also. And so these are key factors. So key factors of those study: enhanced self-esteem. The findings of the study indicate a notable increase in the self-esteem of psychiatric nurses after undergoing assertive training. This implies that when nurses acquire the skills to express themselves assertively, they experience a greater sense of empowerment, respect, and control over the professional responsibilities. And then there was an improved communication abilities also. The training facilitated the development of superior communication abilities among nurses, superior communication abilities among nurses, which are essential in psychiatric environments where interaction with patients, relatives, and colleagues can be complex. By employing assertive communication, nurses were able to establish clear boundaries, thereby minimizing the likelihood of miscommunication and conflict. So decrease in occupational stress. This is the one more result of the particular study, that is regarding the assertive skill. The study also noted a decline in occupational stress among the participants, likely attributable to the enhanced self-confidence and diminished internal conflict associated with increased self-esteem. This observation is consistent with prior, suggesting that assertiveness not only boosts self-esteem, but also act as a protective factor against work-related stress. Next is the assertiveness and job stress. The more we stand for ourselves, the less likely we are able to be manipulated. We are to be manipulated. Assertive behavior increases positive self-appreciation, raises self-confidence, improve performance level. So these are all the studies which proves that assertiveness reduces the job stress. So between assertive behavior and stress among the nurses of selected hospitals proved negative correlation between assertive behavior and stress among nurses. It has been statistically proven that there was a negative correlation between the assertive behavior and stress. So when there is increased assertive behavior, that simultaneously reduce the job stress among the nurses. So assertiveness as a stress management tool. The study highlighted assertive as a key tool in stress management for nurses. By fostering clear communication, assertiveness helps nurses negotiate workloads, clarify expectations, and address conflicts before they escalate. These factors collectively reduce job stress. Mental health benefits. The perception of positive mental health among assertive nurses suggested that assertive nurses not only helps in managing external stressors, but also enhances internal psychological resilience. This is crucial in profession like nursing where emotional demands are high. So nursing is a profession where there is more emotional demands. Since nurses are working with uh, people, those who have a lot of expectation regarding their care. So nurses have to manage the patient and also the patient family members and also the colleagues, health teams. So when the nurses are maintaining an assertive behavior, that time that helps them to improve their mental health also in positive way. Training recommendation. So how these assertive training can be applied. So how the research author has applied this research assertive skills. So by means of assertive training through education and also some of the staff development programs. These are being used to improve the assertive behavior among the nurses. So then Mahabadur et al. Studied the effectiveness of assertive skill training on job stress among the staff of emergency medical center. Again, the study results revealed that assertiveness training was most effective in reducing stress among the staffs. So in their study, Neff et al. Explored the combined effects of assertiveness training and mindfulness techniques on reducing chronic. So these are other experimented with two techniques, so the assertive training and also mindful techniques. The research aimed to assess whether integrating these two interventions could provide synergistic benefits in managing stress and enhancing emotional well-being. Then Akshay conducted a study to assess the relationship between assertiveness and job burnout among the bank managers at Pakistan, concluded that increase in assertiveness decreases the burnout. And Marjani, the study et al. The study assessed the effectiveness of assertiveness training in reducing job stress among school teachers in Iran. The findings indicated a significant reduction in stress level post-training, with assertiveness helping teachers to better manage classroom challenges and professional interaction with colleagues and administrators. Abraham et al. In a study, the author explored the effectiveness of assertiveness training programs in reducing job stress among healthcare workers. They found that participants who underwent assertiveness training reported lower levels of occupational stress and attributed to improved communication and better conflict resolution skills. The study highlighted the role of assertiveness in helping employees manage work stress more effectively. So then Baran et al. In their research focused on corporate employees assessing how assertive behavior could mitigate the adverse effect of job stress. The study concluded that employees who practice assertiveness were better at handling work pressure and that reducing burnout rates. It emphasized the long-term benefits of assertiveness in maintaining the mental well-being. Then Khosravi et al. And their study investigated the effectiveness of assertive communication training on job stress among nurses. Again, there's a more study among the nurses in high pressure hospital environment. The researcher found that nurses who participated in assertive training experienced a significant reduction in their job stress. The study attributed the reduction to nurses' enhanced ability to set boundaries with the patient and colleagues, leading to fewer conflicts and better work-life balance. So assertive communications is not only reduce the job stress and that guide the nurses how they can maintain such a boundaries with the patients and colleagues, in how effectively they can maintain a communications, what is a boundary for their therapeutic communications, everything will be clear by maintaining a assertive communications. So next setting is assertiveness and conflict management at workplace. So how the assertive techniques can be utilized to manage a conflict in the workplace. So Motahari et al. Conducted a study to identify the effectiveness of assertiveness skill in managing interpersonal conflict at workplace among nurses at selected hospital at Iran. Concluded that assertive communication guide nurses to manage interpersonal conflict. The more they adapted assertive skill, the more they applied collaborative style to conflict management. And Lucia et al. aim to reveal the assertiveness and psychological safety in receiving criticism among the professional who were held superior posts as a qualitative research quoted that assertiveness on psychological safety. So this is what in qualitative study here the researchers stated that that assertiveness improve the communication style to facilitate addressing and potentially conflictive issues between people who have an interdependent relationship. And also, so that is what, so improving that assertiveness. So this is what an qualitative study. So by improving that assertive communication that facilitate to address the problems among the nurses and also in that resolves the conflictive issues between the nurses when there is an interdependent relationship, and also that helps to maintain a better IPR with the team members also. And then this is a study by Zain et al. Study explored the impact of assertiveness training on reducing the stress among call center employees. So of course, the call center employees face a lot of problems when they're talking with the customers, especially. So a group known for high levels of occupational stress also. The results show that assertiveness skills enable employees to handle difficult customer interaction more effectively, thereby reducing their stress levels. Then next heading is, so how practically we can apply these assertive skills in such areas. So healthcare sector is a main area where there will be a lot of problems arises. There will be a lot of problem arises due to lack of confidence and also lack of self-esteem and also lack of communicative skills. So health professionals, including nurses, physicians, and administrative personnel, frequently operate in high-stress environments characterized by extended working hours, critical decision-making responsibilities. So these are all the areas where the healthcare sectors people face work stress. See, there will be a and there will be an extension of working hours and also workload and also the critical decision making. That is especially when there is ethical issues arises, and then emotionally taxing situations. In these all situations, there will be a lot of stress to the nurses and also the other health workers. Assertiveness training with this field aim to enhance communication skill with the patient's family and colleagues, as we have discussed in previous studies. So assertive communications which help them to improve their communication skills, and also they helps them to improve their rapport with the patient and also family members and colleagues and health team members also to manage the workload and also to address their problems. So this is an example study. So in this study that they have used some of the techniques. So Abraham et al. Conducted a study showing the healthcare workers who underwent assertive training reported the decreased stress and improved job satisfaction. So what the technique they have used? So again, one more study. So in this study also, this Serafis et al. Apply the assertive technique to improve the to reduce the job stress. So the application assertive training can be incorporated in professional development initiatives, equipping health workers with the skill to articulate their needs and concerns in managing that is neither aggressive nor passive. For example, we can discuss a nurse may learn to communicate assertively with a physician regarding patient care decision, thereby minimizing understanding and reducing the risk of burnout. So education sector. So educators and school administrators often face significant job-related stress stemming from factors such as oversized classroom, difficult students contact, and also various administrative responsibilities. So assertive training serves as a valuable tool for these professionals, equipping them with the skills necessary to establish the clear expectation with students, parents, and also fellow staff members. So these are all the example studies regarding the assertive training for the teachers. So after the training, teachers reported feeling more confident in their interactions with the students and also the parents, and also more capable of managing classroom dynamics effectively. So the application, this training can be implemented through workshops that replicate classroom situations when assertiveness is beneficial, including managing disruptive behaviors. So here, so we can use a workshop and also the role play methods that can be effective for teaching the assertive skill to the teachers. So next in the corporate environments, in corporate setting, stress often stems from deadlines, hierarchical pressures, and teamwork dynamics. Assertiveness training in these sectors helps employees to negotiate workloads, provide feedback, and manage upward communication with managers and superiors smoothly. So that Baron et al. Again, the study regarding the how to manage job stress in case of corporate sectors by using the assertive skill. And this is one more example study for the cooperating settings. Then applications. So in these areas, so by using the role plays and also the performance evaluations and also workshops can be helpful to improve their assertive skills. And then practical ways to apply in customer services. So again, the study demonstrated the customer service representative who received assertive training experience lower stress levels. And then this customer service, again, representative frequently, those representatives, customer service representatives frequently deal with the difficult customers, leading to high levels of stress, especially when they are adapting some communication styles with those customers. So our assertive training focuses on teaching employees to handle compliance assertively while maintaining professionalism. So these, while applying these assertive skills, so those persons working as the representatives, so they can handle their customers in a professional way by adapting the assertive communication styles. And then applications. So these also by role playing. So by role playing exercise, when employees practice assertive response to common customer service scenarios, such as handling irritating customers or negotiating solution with escalating conflicts. So conclusion, all the above literatures clearly stated that the positive impact of assertiveness training on reducing job stress, emphasizing the improvement in communication, conflict resolution, and boundary setting abilities that come with enhanced assertiveness skills. So assertiveness training can be tailored and applied to various job sectors or professional settings, particularly those characterized by high levels of stress due to frequent interpersonal interactions, complex demands, or emotionally charged environments. Let's break down how assertive training can be adapted and implemented effectively in healthcare education. Healthcare settings, education, and corporate environments and customer service settings. So these are the general strategies or the ways for implementing the assertive training. So the team or the employers or the managers or the administrators, so they can plan some of the workshops and role playing. So these allows the employees to practice assertive communication in a simulated work scenario, especially in case of healthcare team and also for the teachers. So online training modules can be very useful for the persons those who are in the shift work. So online modules provide flexibility for the employees to learn at their own pace. So they through online mode they can attend the training whenever they wish or whenever they're free from their work. Then ongoing support follow-ups sessions or peer support groups. So after that, so feedback can be received on those feedbacks and be reviewed, and any areas where the trainees feel difficulties on those can be reviewed, and with the peer support that can be cleared, and then again reinforcement of the assertiveness skill can be given to the area, such areas where the particular person feel any difficulties to learn the assertiveness skill that can be reinforced by doing a follow-up sessions. So these are the reference. So let me summarize. So far we have discussed what is meant by the job stress and what are the ways to handle the job stress, especially the assertiveness skill. So assertiveness skills can be applied like through communication, especially as assertive communication and assertive behavior. And then we have discussed how the assertive skill, learning the assertive skill helps to uh, relieve the job stress, and how the assertive skill helps to manage the conflict and the work environment, and also how assertive improves the mental health of the person. Everything we have discussed, and some of the strategies for implementing the assertive skill in the various environment like health sectors and in education areas and in corporate areas and also customer care services. So these are all the areas where the employees feel more stress. So in those areas, they can apply and also they can plan this assertive skills through workshops, role playing, and also online training modules likewise. So any questions? Thank you. Thank you for your patient listening. So any questions?
Thank you so much to Dr. Jothilakshmi for the insights.
Thank you, guys. Thank you.
Yeah. So everyone, we got insights and knowledge about on the topic assertive training to cope with job stress. It was a narrative analysis by Dr. Jothilakshmi, by Dr. K. Jothilakshmi. So, all right, if you are having any questions to be asked from Dr. Jothilakshmi, you can ask your questions. You can simply raise your hand and come up on your screens, unmute yourself. And while you were explaining, doctor, we got a few questions which we are sending in the chat box. Or if you want, I can read them up for you. Okay. Can you see the question, doctor?
Let me check.
Okay.
See, so there is a difference between the assertiveness and aggressiveness. See, assertiveness in the sense where you're using your emotional intelligence. By using your emotional intelligence, you are handling the situation in such a way in a polite manner. See, but in case of aggressiveness, where there is a lack of emotional intelligence. See, the person expressed something in such a way with a emotion, either by anger or something. They have some expression like negative emotions, we could say. See, in case of assertiveness, it's not like that. See, here the persons clearly explain their desire or what their opinions they share in such a polite way, and where there is a situation arises. I mean, the situations, if it is not okay with that particular person, the person can boldly express that, saying no to particular situations. So that is called assertive. But aggressive people, so they won't like, they cannot express in such a polite way. So politeness is the main thing. Politeness and strongness in your communication or in your expression. That is called assertiveness. I
All
hope.
right. Yeah. Thank you for taking the question, doctor. Dear teammate, can you send the next question, please? Okay. Here.
Yes. Is there any question?
Yeah, there is the next question. Can you see the question, doctor?
No, I couldn't see.
Okay, okay. Let me send this question directly to you. Right. Can you see the question now?
does assertive training impact? Nice. Once again. And see, when we are talking about the assertive communications, so it takes time for the persons. See here, we are not talking about the immediate stress management. So that is in the it's like a preparation. So when the persons when that depends upon their own scenarios, or depends upon their own experience. So collectively it is being so some here I forget to quote about some of the qualitative studies. See, assertive training, it's like commonly it's assertive behavior and then assertive communication skills alone. So what to say, that assertiveness, it's on a single person's opinion. It's like how the person is expressing their opinions or ideas in an assertive way. So when the different scenarios arises, the person has to the person has to behave in such a way. So that is can be demonstrated like through role plays or through some workshop like only. So that immediate stress management can be something different. So that cannot be an immediate measurement for the stress management. So it can be in preventive measures. Assertive skills can be in preventive measures to avoid job stress. Is any question?
Yeah, there's one more question. I hope you can see it on in the chat box. It's about organizations integrate assertive training. Or should I send it personally to you, Doctor?
Wait. So that is what I said. So in an organization, so persons, those who are, they can get a help from some of the psychologists. They can very well teach like a staff development program. See, this is not going to be a burden for the employees. I think so. That's what I said. There will be an online training mode also available, online training modules available, and then simply that can be they can organize it as like a staff development program or employee development program. So through that employee development program, some of the psychologists, so they can demonstrate how the person can be an assertive, how what is meant by assertive communication skill. So everything they can demonstrate it, or that through like a workshop or like role play or some scenarios can be created, and that can be played by the employees. Among the employees, those who are volunteers, they can play along with the guidance from the counselors. So especially, so I have went for a program regarding so how the Anganwadi workers can can reduce their job stress. So in that, we have planned for some of the role play and all. So likewise, so the Anganwadi workers, especially on Saturdays, we have scheduled that program, and then we have planned some of the role play, and then role play regarding this, and also the video presentations like how to relieve the job stress. And so likewise, we can plan some of the role play or workshop or trainings like a staff development program. So how the personality development program. Likewise, we can plan some of the development program for the employees along with the guidance of specialists.
Great. Thank you so much for taking the questions, Dr. Jothilakshmi. It was great to listen to you. Thank you so much for the presentation and the insights.
Thank you, Dr. Dilson.
Stay
Thank you,
connected.
team.
There might be more questions for you later, as the LinkedIn Live plays a little late than the live meeting room.
Okay.
Yeah, please stay connected. And with your permission, let's move to the next speaker.
Okay,
Yeah.
okay, fine. Okay, thank you.
Thank you so much. So, everyone, let's welcome Dr. Pinar Sengul. The title of her talk is Benefits of Optimum Stress and Anxiety. a pathway to achievement.
Thank you, Gazal, for the introduction. Shall I start?
Sure.
Thank you for this lovely conference.
It's always our pleasure to have
And
speakers like you and Dr. Jothilakshmi.
And thank you very much for inviting me again.
Thank you for the
Good
initiative.
afternoon. Good afternoon, everyone. Today, I would invite you to explore a topic that's misunderstood as it's universal: stress. Too often, stress is seen as the villain in our modern lives. But however, today I'm going to tell you that stress is not the enemy. It's a sculptor of our resilience. It's the challenges, the rough moments that prepare us for growth. As the saying goes, it's the rough that makes us smooth. With neuroscience and neuropsychology as our guides, let us delve into how stress can shape, strengthen, and even transform us. We can change the slides sometimes, yes. Stress begins with the activation of the hypothalamic pituitary adrenal axis, HPA axis. It's in the next slide. Oh, sorry. Before that, I will. Yes, the next slide again. I need to define the two different stresses. But whenever we refer to stress, the thing that the first term that comes up to our mind is this stress one. We always refer to this stress whenever we are using stress. However, there's another type of stress we miss, which is eustress. You can etymologically understand the different meanings of U and D. You can think of utopia and dystopia. So U gives the positive meaning. That also comes from the Greek ancestry. Eudaimonia, it means happiness. It starts with the EU. So the U is always the positive annotations and the D is the negative side. So we always refer to distress, the type of stress that we are referring when we say is a form of stress with negative implications. Whereas in eustress, you have a beneficial effect on your health, motivation, performance, and well-being. So today I'm going to concentrate on this eustress part that we often miss. The next slide. Here in the next slide, yes, this is a graphic. It's a inverted U shape, the inverted U shape, where stress is impactful in our lives. It's a very well-known theory by Yerkes and Dodson, and they named the graph this psychological effect as Yerkes-Dodson stress and performance curve, where you can see as the stress increases, there is a peak point where you achieve your best. So as your stress increases, you get more focused and motivated. And that's a healthy level of stress. Let's say eustress as well. And in the beginnings of the stress, in the beginnings of this rise, you can see it's lame. Your performance is lame. You have very low stress, but your performance is also accompanying very lame. It's inactive and you are mostly bored. And after the peak performance, as your stress gets more, you get fatigued and your performance starts getting lower. And then as stress gets higher and higher, you get to be sick, you get exhausted, panicky, and high anxiety levels. And as it gets on extreme levels, you can be very angry and also see the symptoms of burnout and breakdown. If you can keep your microphones on mute, it will be very nice. Thank you. Next slide, please. This is the neurobiology of stress. It's very important to understand how stress occurs in your physiology and your body. It begins with the activation of hypothalamic, pituitary, and adrenal axis. So the first two I mentioned in your brain. And the adrenal gland is on your kidneys. That's in your body. So that's called HPA axis for short. Here there are two images that you can see from hypothalamus. Then you create an hormone called corticotropin releasing hormone, CRH, goes to pituitary gland in your brain still. That activates ACTH, adrenocorticotropin hormone, that activates and stimulates your adrenal glands and releases cortisol if you're a human, and it could be also corticosterone if you are a bird or a rodent. So that is the mechanism of creating stress psychologically and the stress hormone. On the other image on the right hand side, it's an easier image for understanding. Hypothalamus goes to anterior pituitary. So pituitary has two sides, anterior and posterior. So in the anterior side, you have most of the hormones, by the way. It activates your adrenal cortex via ACTH, as I mentioned before, and then the cortisol is released in your system. The stress begins with this activation of the HPA axis. This intricate system connects the brain and the body, releasing hormones that prepare us for action. Stress is an activatory trigger. It's an action trigger. So let me tell you what hypothalamus is. It's the brain's control center, where it detects a threat and signals the pituitary gland. The pituitary gland, a very small little organ-like thing in your brain, is mostly responsible for the hormonal secretions. It releases adrenocorticotropic hormone, ACTH, instructing the adrenal glands to release cortisol. And lastly, the adrenal glands, they're located above the kidneys. They produce cortisol or corticosterone if you're something else, another species, and the body's primary stress hormone, and adrenaline, which heightens alertness and energy. These two hormones initiate fight or flight response. Also, it could be freeze and flee response in other species, such as rodents and some birds as well, which I will tell you basically in a minute. If your hormones initiate the fight or flight response, the sympathetic nervous system, it increases your heart rate, cortisol, the body's primary stress hormone, and it redirects body blood flow to the muscles, sharpening your focus. This process is very essential for your survival. It prepares us to face challenges head on. The other one that I mentioned is also a sympathetic reaction, but it is not fight or flight. It's freeze and stay. So most rodents, such as, like, when I say rodents, I mean mice and rats, they tend to freeze when there's a threat. So that reaction is also very important for survival because when they freeze, they avoid showing some action and movement or making any noise so that the predator or attacker doesn't see or realize where the prey is. So they avoid their predators by not moving. So that's another strategy, by the way, which can be very useful in some cases. We can move to the next slide. So stress isn't inherently bad, as I've been talking about since the beginning of the slide. In fact, moderate stress, often called eustress, has remarkable benefits for the brain. The first one that comes up to our minds is the memory and learning. Cortisol in small doses enhances the function of the hippocampus, improving memory retention. This is why a manageable level of stress often sharps focus during exams and presentations. The second one is the decision making. The prefrontal cortex, responsible for planning and problem solving, becomes highly active under short-term stress. This ensures we can think critically and make quick decisions when needed. And lastly, neuroplasticity. Stress also promotes neuroplasticity, the brain's ability to adapt and form new connections. This is the very mechanism by which challenges foster growth and learning. We can move to the next slide. In this image, you can also see as the stress increases, you go from good memory to necrosis, or cell death. You can see aging and neurogenesis. Most of the time, it's not neurogenesis, by the way. It's most of the time apoptosis and necrosis when stress is very high. But when I'm talking about eustress, I'm talking about the optimal levels of stress. So you have to look in the middle, where synaptic plasticity and new connections occurring. If Ms. Ghazal is here, can we have the next slide, please? I'll continue with the risks of chronic stress. When prolonged stress tips the balance, overwhelming the brain and the body, you have cortisol overload, amygdala hyperactivity, prefrontal cortex impairment, and neuroinflammation. I'll tell you what they are very briefly. The cortisol overload, it damages the hippocampus via chronic cortisol release, impairing the memory and increasing the risk of mental health disorders. The amygdala hyperactivity is when the amygdala, the brain's emotional center, becomes overactive, heightening anxiety and fear responses. And the prefrontal cortex impairment is sustained stress, weakening the PFC, reducing emotional regulation, focus, and decision making. Lastly, neuroinflammation links to depression and cognitive decline, because chronic stress triggers inflammation in the brain, linked to conditions like depression, anxiety, and cognitive decline. This is why managing stress is critical. Not to eliminate it entirely, but to keep the range where it enhances rather than hinders you. Next slide, please. It's an image for ease of understanding the risks of chronic stress. Trouble sleeping, high blood pressure, increased heart rate, heart attack, heightened risk of heart attack. Dysregulated nervous system, fatigue, anxiety, depression, mood changes, weight gain, which is very much common. And in women, we see menstrual cycle changes, and in men, we see decreased testosterone and sperm motility, so impotence and also erectile dysfunction as well. Next slide, please, Ghazal. The psychology of stress. We need to find the balance. So I'm telling you not to entirely avoid stress in your life, because when you entirely avoid stress, you tend to become an underachiever. In other words, a lazy person that is not productive. So stress is definitely needed in everybody's lives, but we need to find a balance, a common ground between high stress and low stress. So from a neuropsychological perspective, the key to managing stress lies in reframing it. Studies show that viewing stress as a challenge rather than a threat changes how the brain responds, reducing its harmful effects. So whenever stress comes, think of it as a challenge that you have to overcome, not a threat that risks your survival. Here are 3 practical strategies on the slide that are grounded in neuroscience and psychology. The first one is the regulation of the HPA axis that I mentioned in the beginning of the slide, the hypothalamic, pituitary, and adrenal axis. In order to regulate that, you can practice mindfulness or deep breathing to calm the hypothalamus and reduce cortisol production. So deep breaths. Deep breathing is key to slowing your and regulating the HPA axis. The second one is the strengthening the prefrontal cortex. How to do that is, oh, by the way, I forgot mentioning, for the HPA axis, you can also do regular physical activity, not intense activity, by the way, like up to an hour of walk a day. I'm not referring to high cardio activities because we know that intense exercise can also be harmful for your brain and your body in the long term. So regular and non-intense physical activity is also recommended to release brain-derived neurotrophic factors, which is BDNF for short, a protein that supports brain health in optimum levels. Second one is the strengthening the PSC. Activities like journaling and meditation can enhance your prefrontal cortex activity in a good way, by the way. Also, like when you have enhanced prefrontal cortex activity, it doesn't always mean it is good. So if it's very high, just like the Yerkes-Dodson graphic I've showed you, it can get you fatigued, angry, burned out. So this is the bit that everything goes when you're highly intellectual. If you overuse it, you can also get, like, in common, in lay terms, you can go, like, you can get mad, you can go mad. So yes, you can always go back to recovering it, obviously, but try not overusing it and just listen to my recommendations and don't do what I do because I'm overusing it. So do what I say, don't do what I do. I know that I need to also regulate my PSC activity because I'm relying so much on this. Nearly 70% of my day goes with PSC activity, and that's not very, very healthy in the long run. I know that that's gonna be too much brain-derived neurotropic factor, causing perhaps in the long term, in chronic, like 40, 50 years, can cause early memory problems because of the stress load that I have. So I'm trying to also balance it out. It's a problem that I face in my life as well. But overall, I really like stress. Use stress. I use it. I use the benefits of it. But sometimes I overstep that line and kind of go to the other side of the Yerkes-Dodson graphic. So I recommend everyone to use the benefits of use stress and try staying on the peak of the graph, that inverted U shape. Try staying on the peak. And lastly, you can leverage use stress. That's what I'm talking to you about. You have to set achievable challenges. So you shouldn't always go over that challenge and set crazy unachievable challenges and leave yourself sleep deprived that might cause other problems. Whether it's learning a new skill or tackling a project, small doses of stress paired with a sense of control lead to growth. So the key thing is there is the sense of control. Sense of control. That's the key. Even if you have good amount of stress, do not overuse it. Next slide, please. So to conclude, I would like to say that it's the rough that makes the smooth. Most people miss that. Stress can be a way to achievement. Without that stress, you cannot have the smooth, the good sides of the life. So just making it very basic. In order to become rich without inheritance, you have to study hard, work hard, and earn your own salary, right? And become a successful person. So without doing all those steps, walking over those ladders, you cannot become someone successful. So you have to go through the rough. So stress is needed. It's a necessary thing. And if you keep avoiding stress fully in your life, you won't come to a place that gives you the benefits of life. You cannot have the good part of the cake. You cannot have the cream. So you have to go through the hard bits and then earn your earnings. Stress is not merely a challenge. It's an opportunity. You have to see that it's an opportunity. As neuroscience teaches us, stress in moderation enhances memory, sharpens focus, and fosters resilience. It's rough moments in life that shape us, polishing us for the smoother path ahead. So the next time you feel stress creeping in, remind yourself, it's rough that makes it smooth. Harness it wisely and let it sculpt you into your best self. Thank you very much. Growth is stress plus rest. If you have any questions, here is my email address. And you can also connect me via LinkedIn.
Okay, so now we got insights from stress to rest by
Yes.
Dr. Pinar. Okay, so I would invite any questions for Dr. Pinar. Actually, we had some. Dear teammate, can you please send the questions here in the chat box? Okay, there we go. Can you see the question, Dr.
Yep.
Pinar?
Let me read it out loud. What is the most surprising or counterintuitive finding from your work on the benefits of stress and anxiety? As a starter, I am not working on stress. I'm not a stress researcher, but I'm a neuropsychologist and a neuroscientist that I can always interpret things about the brain and the mental health. So that's going to be an interpretation and a personal analysis from my life and my readings, obviously. The benefits of stress and anxiety is production, achievement. That's easy. The second one is the second question. What practical techniques or habits would you recommend for individuals to manage anxiety and channel it towards positive outcomes? That's a very nice question. You need to channel your stress into a positive outcome. You need to find a way and make your stress worthwhile. It has to give you a positive outcome. So how to do that? I mentioned in my slide that you can do journaling, so you can reflect on what's going on in your life and have a outer look at your emotions and thoughts. you have to remind yourself to take breaks. Whenever you feel burned out, just go out and have a walk for an hour. Don't do it, don't overdo it though. So when you manage your stress, you also can manage your anxiety at some point. And third question, how can individuals with anxiety disorders distinguish between stress that's beneficial and stress that's harmful to their mental health? That's an easy question. In order to distinguish between eustress and distress, you have to look at if that gives you a positive outcome. You have to see if there's a reward. You're stressed, and if you're working hard and you, for example, create a masterpiece, you make a, if you're an artist, you make a nice artwork. If you're a singer, you write a new lyrics. If you compose a new song, if you're a scientist, you come up with new theories. If you're a writer, you write a new story. That's eustress. You see that production. But if you're distressed and you're a writer and you don't compose anything, you don't write anything, you don't come up with new writings, then you tend to complain about it nonstop and become dysfunctional. That is when you're using your stress in a harmful way, and you have to change things into becoming more productive and beneficial for yourself. And the first step should be first giving yourself some space, walks, music, journaling, and then reflecting back on your plans again would be my suggestion. And another question from Jozan Prague is, can you suggest solution for some cognitive issues like forgetting, thought block resulting from stress? It also sounds like you're mentioning distress. So distress occurs when there's too much stress, remember. So you have to manage that to take it back a little notch down to normal optimum levels of stress. So how to do that? Take a moment, meditate if you can. Just close your eyes and have deep breaths for 5 minutes if you can, or 2 minutes, even that helps. And then find what is not balancing your plans and possible goals. And you have to just make a schedule for yourself. Write days you have to achieve for a day, and do not try to make it, do not set unpredictable goals. If you have to achieve, like, let's say 5 X's per day, write down 3 X's, not to be over stepping it, not to be too fantasizing about it. Let's be realistic at the start, because if you have some forgetting problems, you are being at some point unrealistic with yourself. You have to become more realistic. What can you achieve? 5 X's? Okay, let's write 3 X's per day. So, and as you go, you will see that you will find some better ways to manage your forgetting problems and the stress, and then you can start back to doing whatever you can per day, like 5x per 5x, 4x 4x. So that's like effort per day, let's say. And stress causes forgetting. Too much stress can cause forgetting. I'm rephrasing my word, but a good amount of stress will increase the likelihood of remembering. So that is a good balance. Good stress is good for you for preparing for your exams, your presentations, your meetings. It enhances your BDNF, so more connections in hippocampal areas. But if it's too much, less connections. So that there is a balance you need to find with yourself. Everybody has different balances. Find good sleep habits. At least you have to sleep 7 hours per day, at least. Everybody has a different amount, 7 hours to 10 hours. Find that sleep balance. Find your diet balance. Find your physical balance and find that balance of overloading yourself. Where is that amount that you overwork? Do you have to study 5 hours per day, but you're doing 7 hours? You have to see that and take it a notch down. That's the recommendation I can give for you, dear Jotham Prague. Hope that answered the question. If there's more and if I've been complex, I can try more.
Yeah, Dr. Pinar, it was Dr. Jothilakshmi by the name Jotham Prague. It's the first speaker who just lit the screen when you
Yes.
entered.
Yes, yes.
Yeah. I hope the answer satisfies Dr. Jothilakshmi. So anyone who is having any more questions to be asked, you can ask your question now. Thank you so much to Dr. Pinar for taking up the questions.
Thank you, Ms. Joar.
Okay. Now it's Mrs. Jor. I'm married now.
Yes, yes. I'm sorry, I forgot.
We met from last to last. I was unmarried. Yeah, okay. I'll change my title from the next time. So much for reminding me. Yeah.
Sorry for forgetting, though. I knew that.
Yeah, I mentioned that to you. Okay.
It looks like there are new questions. Am I correct?
Okay. Let me ask. Is there any questions to be asked from Dr. Pinar? I repeat. Okay. Till then, let me take a moment to announce about the next event we are coming up with. Okay, everyone, the next event will be International Live Conference on Neurochemistry of Conflicts, Wars, and Religious Strifes. So the event will be on January 25th. If you are interested in joining the event or providing any insights or want to speak up on this, on any topic related to that event, please send your research abstract or reach out to us. Okay. Also, I would like to request to all of you to kindly share your details here. The details are your full name with your title as your designation and your country name. As I could see, there were many new. Okay. There is someone. It is Dr. Naveen Rahman. She mentioned something for you. Okay, appreciation note. Thank you so much to Dr. Naveen Rahman. I was just mentioning that I saw some very new names this time.
Thank you, Mrs. Rahman. Thank you for the nice commentary. I'd like to connect on LinkedIn with you.
There's appreciation from LinkedIn as well. Mugi Sandhya. Thank you so much, ma'am, for clear clarification. Okay. All right.
Wait, if the other speaker is still around, she can answer another question.
Kindly keep yourself on mute, dear attendee. If you would like to ask anything.
There is another question. Maybe you can see the second question. She can answer that. Jotham Prague, if she's still around.
Yeah.
Is she still around?
Hello, Dr. Jothilakshmi, are you here in the meeting room?
Okay, I can answer that. There's another question. How can individuals identify the optimal level of stress that enhances performance without negatively affecting mental health? Identify without negatively. I told you that that's very easy. You have to look if you're productive. And if you're too stressed, you cannot be productive anymore. So you have to see that point when you become no more productive. And when you lose your production, your functional capacity, then that's negatively affecting your mental health. That's where you have to give it a break. The second question is, what practical strategies can professionals adopt to develop assertiveness and resilience? That's the word that that was the whole term that I was talking about in my slide. Stress makes you resilient, and that's why we need stress. Coping with workplace stress. What practical strategies can professionals adopt to develop assertiveness and resilience? I think that goes for everyone, the recommendations that I've given for developing resilience. Journaling, physical exercise, meditation, doing yoga, even talking to your closed loved ones, like your family, your mother, it could be, which is in my case, my mother. Spending good amount of time with your family or your partner, if you have one. So that is helpful with increasing the resilience. So yes, you shouldn't bring your workplace stress from work to home, but it is not very doable, is it, to like separate them very sharply? So whenever you go home, if you have a partner, you will have a little chit chat over your problems, and confining in a loved one like a partner or parent can help you quite much. I use that a lot in my life, and sharing your problems with your partner or parent, it feels like you have somebody that you can confide into and you can conform to and trust in. So it does increase your resilience, because those people will always tell you that there is somebody with you, standing with you, and that they trust your intelligence, your determination, your personality. Hearing those words are very, very helpful, which is called positive affirmations. Love is another support in increasing resilience for sure. You shouldn't be alone fully. You need someone in your life, not just a boyfriend or girlfriend. Your mother, your father, your brother, your sister. Have someone in your life that you can rely on. That's my closing words.
Is it sense of safety we were talking about right now?
It can increase your resilience. Yes, safety, but also hearing that you are somebody that you're like your partner when he comes to you and tells you, Ghazal, you can do it. You're successful. I know you're sleepy. I know you're tired, but I trust you, girl. Hearing that word changes everything in your cells. It lights up everything, doesn't it?
I agree with you. Totally.
Yeah.
That always helps. Actually, that helps the most for most of us.
Yes. So we have to be more talkative with our feelings too. I think we shouldn't just bottle them up. That's a big, big problem, leading to becoming non-resilient and developing distress. When you talk things up, when you open your feelings, things change.
With our quality people, right?
Yes, yes.
Okay. So we got some more questions and you answered all of them. Thank you so much, Dr. Pinar.
No worries. You're welcome. It was a pleasure for me as well.
Great. You're always like with light energies, with some sunshine auras. Thank you very much.
I'm a little burned out, by the way. I'm doing too much overuse of my brain, so this is my burst.
Okay, there is one more comment we got from Dr. Naveen Rahman.
So she says, people don't seem to understand what positive affirmations can do for you, and giving validations to feelings is extremely important. Yes, that is a great, great word. That was the word I was looking for. I forgot mentioning. Validation. It's a type of love language, one of the 5 types, and that is very needed. Like every lover, but by lover, I don't just mean your partner. Anybody that loves you, they need to validate you. Validation is a type of love, and it should be always inside any loving relationship.
Exactly. So we are having Dr. Jothilakshmi again in the meeting room. Earlier, there were some
Yes.
network connectivity issues, but she's here. So
Yes.
if she would like to add on to the last asked questions, Dr. Jothilakshmi,
Yes. The second question regarding how be training can be for the improvement of mental health as a long term. Yeah, couldn't get. Could you get my point?
yeah, last time you were in between, your
Yeah.
voice was
I'm
breaking.
audible?
Yeah, perfectly now.
Okay. Actually, that assertiveness skill that improves a person's self-esteem and also that reduce the anxiety and stress level. So thereby it can be a solution for the long-term mental health improvement. So you're able to understand what I'm saying? Yes. Got my point?
Yes, doctor.
Uh,
Thank you so
actually,
much.
the question. Okay.
I'm sorry, you were saying something. Did I interrupt you?
No. I thought that you didn't get the point like that. I go. So that's why.
Okay. So now
Yeah.
Okay. Now I would like to request to all of our attendees to kindly share the asked details here in the meeting room now in the chat section.